Okay, good evening. February the 5th. This is our regular committee meeting that has been moved to Monday night temporarily. So we will go ahead and get started. So hopefully we can move through everything in an expedited manner. We do have a public comment pursuant to Council Rule 28 and state law. Public comment is limited to matters that are about items on the agenda. You may only speak about items that appear on the agenda. And we have Mr. Mike Lacey, who is here to talk about RS 2024-201. And Mr. Lacey, you are recognized.
Hi again, if you were here from the budget meeting earlier. I'm on the fence about this proposal because I don't see yet how, if it's to be implemented coherently into a real plan to address public health and safety in our city with the current state of oversight. This is my first time addressing the committee since working for either the last two mayors or the current mayor in the last one, and I'm going to take the opportunity to speak a little more openly than I used to. The reality is, as a city, maybe as a country, the further we get from the summer of George Floyd's murder, the less we seem to care about violence in our communities, especially the violence that most affects socially vulnerable people and people of color. We all just looked at the CSP as filtered by social vulnerability. The plan now has 48% going to highly socially vulnerable residents, but few to none of those capital projects actually correlate with what science tells us actually prevents crimes and improves the social determinants of health that prevents their causes. And by the way, even the most specious reading of recent Supreme Court rulings couldn't bar funding that serves the socially vulnerable. Social vulnerability is a really powerful and robust way of looking at prioritizing projects and funding that goes to those who need it the most. So we were willing to throw money at helping people of color when, one, it was fashionable, and two, we had free money from the federal government. But even after the Covenant shooting last year, precisely the type of violence whose preconditions cannot be prevented with purely public safety initiatives, the last administration and the last city council in its July budget reduced the funding that could have been used by any metro department or CBOs to enhance community safety by 50%. They cut the budget in half. The homicide rate is still high. The aggravated assault, carjacking, gun theft rates continue to rise. Empirical science tells us that public safety funding, police, fire, emergency services cannot lower rates of violence on their own. You can't just ring doorbell your way into reducing violence. That's not the types of programs that do it. They're great partners, public safety, but they do not lower violence empirically. A city of our size needs to fund and institutionalize community safety. Not a department that does it all, but oversees if we're doing it. When you adjust the homicide rate and population, we are funding this work at 1/66th what other cities are. That is embarrassing. There is no oversight, no outcome measurement, and minimal to no funding to scale for services that supplement public safety and actually prevent and interrupt violence here.
Thank you, Mr. Lacey. If you wouldn't mind emailing me so I can follow up with you. Thank you. All right. We will move on to our agenda. There is one question that I'm already aware of related to item number 1, which is RS 2024-197. Does anybody have any other items that should not be on a consent agenda? I am seeing no hands. Okay, so consent items then will be items 2 through the rest of the agenda, and I'll read all of those, and then item 1 I'll come back to at the end. So first item on consent is RS 2024-198 by Porterfield Evans and others, appropriates grant funds from the Martha O'Brien Center's Tennessee Opportunity Pilot Initiative Implementation Grant and the Metropolitan Action Commission to formalize the parties' relationship while collaborating on direct services, capacity building, collaborative activities, and grant compliance. Item number 3, RS 2024-201 by Gamble, Porterfield, Stiles, and Vaux, amends Resolution RS 2022-1450, which appropriated $5,546,000 in American Rescue Plan Act funds to the United Way of Greater Nashville to extend the projected program term through December 31st, 2024. Item number 4, RS 2024-210 by Porterfield, Evans, and others, approves a grant contract between the Metropolitan Board of Health and the Mental Health Cooperative to help operate the Mental Health Crisis Treatment Center and provide emergency psychiatric care, including crisis stabilization, respite care, and treatment. Item number 5, RS 2024-211 by Porterfield and Evans, approves an American Heart Association site agreement between the Pre-Medics Incorporated DBA Training Center Services and the Metropolitan Board of Health for students to take course BLS Heart Saver. Item number 6, RS 2024-212, Porterfield, Evans, and others, approves Amendment 1 to a grant from the Tennessee Department of Health to the Metropolitan Board of Health for family planning services. Item number 7, RS 2024-213 by Porterfield, Evans, and others, approves Amendment 2 to a strengthening public health infrastructure, workforce, and data systems grant from the Centers for Disease Control and Prevention to the Metropolitan Board of Health to implement workforce strategies to build organizational resilience, promote employee well-being, and enhance workforce performance while focusing on building healthier communities. Item number 8, RS 2024-214 by Porterfield, Evans, and others, approves an application for a coordinated entry process grant from the U.S. Department of Housing and Urban Development to the Office of Homeless Services to support the work of coordinated entry through staffing, program evaluation, and community education. Item number 9, RS 2024-215 by Porterfield, Evans, and others, approves an application for a Continuum of Care collaborative applicant grant from the Nashville Continuum of Care to the Office of Homeless Services to address the critical problem of homelessness through a coordinated community-based process of identifying needs and building a homeless response system of housing and services to address those needs. And then we have bills on second reading of item number 10, BL 2024-156, Porterfield, Evans, and others, approves an agreement between the Nashville Fire Department, Emergency Medical Services Division, and TriStar Skyline Medical Center for clinical training of residents in emergency medicine. Do we have any items that need to come off of consent? Do we have a motion? It's been moved and seconded. All those in favor, please say aye. Anyone opposed? All right, we recommend approval of those items. So let's go back then to item number 1, RS 2024-197 by Porterfield and Evans. This accepts the terms of a cooperative purchasing master agreement for cloud-based computing for computer-aided dispatch interface communication solutions for the Department of Emergency Communications. Do I have a motion? Okay, it's been moved and seconded. Open for discussion. I know Councilmember Huffman, you still have your question. You are recognized.
Thank you, Chair. There was just a question that I had in regards to the exhibit of within Legistar. The location of the applicant was stated as something in Georgia, Cobb County, Georgia. Could you just comment on that?
Hang on one second. Let me turn on the right. There we go. The admin table is recognized. Okay. Director Darby.
It's a cooperative master purchasing agreement, and so what that means is that another entity, like another state entity, or another group has gone through an RFP process and determined that this, this service or these widgets, I'll use that, and, it's just a general example, are appropriate and that the cost is appropriate. And state law allows us to then utilize that contract that's already been through that RFP process to get this service, which here it's computer-aided dispatch systems.
Got it. Okay, thank you.
All right, any other questions? All right. Seeing no further discussion, we'll go ahead and vote. All those in favor? Anyone opposed? Anyone not voting? All right, you recommend approval. With that, Thank you for attending and being here, and we'll go ahead and we're adjourned.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information on this and other programs, visit nashville.gov.